Chapter 24, Treatment of Allergies. We'll skip over the key terms. We'll go over them in the chapter. An allergy is a hypersensitivity reaction caused by exposure to an allergen. An allergen is any substance that produces an allergic reaction. Pharmacy technicians are at risk for developing latex allergies. Allergic reactions occur when latex-sensitive individuals breathe in or come into physical contact with latex proteins. More severe reactions involve asthma and rarely anaphylaxis, which is life-threatening. The National Institute for Occupational Safety and Health recommends taking the following steps to protect oneself from latex exposure and allergy in the workplace. So you can read through that, but just keep in mind that if you are allergic to latex and you want to work in a hospital, there's really no way to 100% be latex free. I guess you'd have to be really careful. I know at the hospital I worked at, they had to sign like a waiver or something like that saying that it's pretty much impossible. But so we have these products containing latex. So of course, disposable gloves, intravenous tubing, intravenous bag ports, syringes, catheters, injection ports, rubber tops of multi-dose vials. Symptoms of allergy and a cold are similar. However, cold symptoms rarely last longer than 1 to 2 weeks. When a person with allergies first comes into contact with an allergen, the immune system treats the allergen as an invader and produces antibodies to the substance. The allergic reaction sequence is a cascade of events that begins with the ingestion or inhalation of an allergen. Exposure to the allergen triggers an immune system reaction and the production of specialized antibodies, like immunoglobulin E. Antibodies attach to mast cells containing histamine, which when released produce allergic reaction symptoms such as itching, runny nose, hives, and wheezing. The production of allergen-specific immunoglobulin E antibodies develop within the first few years of life. Exposure to high levels of multiple endotoxins early in life, such as when children live with multiple pets, may reduce the risk for development of asthma and allergies. The degree of IgE antibody response varies, and allergens from some sources are more potent than others, like dust mites or cat. Allergic conditions affect between 40 and 50 million people in the United States and are a public health issue because they affect the quality of life, productivity, and performance of sensitive individuals. Persons with chronic airborne allergies may develop allergic Shriners and an allergic salute. Urticaria is also known as hives. It's a condition characterized by itching and angioedema. Redness, swelling, and wheals, blister-like vesicles appear on the skin. Urticaria may be caused by an insect bite, drug or food allergy, or injection of allergen extracts like allergy shots. Acute pharyngeal or laryngeal angioedema must be managed by the administration of drugs that rapidly reduce swelling in the throat and restore breathing. Box 24.2 shows us common allergy symptoms for the dermal and respiratory system. Allergic rhinitis is a condition characterized by nasal itching, runny nose, nasal congestion, and sneezing. Allergic rhinitis is typically self-limiting and will resolve without treatment with anti-infective agents. With SAR, allergy symptoms appear seasonally upon re-exposure to allergens after a period of absence. Allergic conjunctivitis produces red, watery, itchy, or burning eyes. Sufferers may also have ocular puffiness and a stringy discharge from the eye. Drugs used to treat allergic symptoms include antihistamines, inhaled corticosteroids, mast cell stabilizers, and leukotriene receptor antagonist. Administration of antihistamines prevents histamine binding to H1 receptor sites. The half-life of the antihistamine varies, ranging from as short as 4 to 6 hours for diphenhydramine to 24 hours for fexofenadine. Hydroxyzine is metabolized to the active metabolite citrazine. Desloratadine and loratadine are formulated as disintegrating tablets for rapid dissolution and onset of action. Antihistamines that cross the blood-brain barrier decrease alertness and or produce sedation. Antihistamines that are classified as ethanolamines, like diphenhydramine and phenothiazines, produce the most sedation and have the greatest effect on the body. Because of its sedating effects, diphenhydramine is also administered for the treatment of insomnia, and that's just Benadryl. Antihistamine should be used in caution with men that have prostate disease, people with asthma, breastfeeding women, and it should not be used in children younger than 2 years of age without recommendations from the doctor. Most of these medications are over the counter. So Zyrtex over the counter, chlortrimeton, Tavis 1, Benadryl. You can see all the different dosage forms. Fexofenadine, which is Allegra, Claritin. And then we have prescription antihistamines like Bilistine. Well, that's not available in the US, but Clarinex, Astelin, which is a nasal spray. Glucocorticosteroids are inflammatory drugs that are administered intranasally to control symptoms of allergic rhinitis. Flonase, Rhinocort, Nasacort AQ, Nasonex, and Becanase AQ are examples of glucocorticoids that are marketed for use in the nose. Some patients may develop a candida infection in their nose that may present as burning or stinging in the nostrils. Here's just some more information on those nasal sprays. Shows prescription and OTC. Cromolyn sodium and nitochromol are classified as mast cell stabilizers. The drugs make cells less reactive to allergens, thus decreasing the release of inflammatory substances. Cromolyn is approved for intranasal and ophthalmic use, but nitochromol is manufactured for ophthalmic use only. These medications are not used to treat acute symptoms. These are medications you take before coming into contact with allergens and continue for the duration of allergen exposure. So we have them listed here. You can see the nitochromol is just the ophthalmic, and the cromolyn sodium is the nasal spray and the ophthalmic solution. The leukotriene receptor antagonist montelukast is used to control allergic rhinitis symptoms. Montelukast is a selective antagonist of the cystenyl leukotriene D4 receptor, which is found in the human airway. Montelukast may produce cough, hoarseness, sore throat, headache, indigestion, heartburn, stomach upset, or runny nose. It can also produce difficulty sleeping, dizziness, drowsiness, muscle aches or cramps, or unusual dreams. So in this chart, we have the Singulair. It's available as oral granules, so you can make it into a suspension, a 10 milligram tablet, and a 4 milligram and 5 milligram chewable tablet. So now we have the summary of drugs used in the treatment of allergic conditions. And we'll go through the warnings for the drugs. For Astelin, you should prime the inhaler before use. It can cause sedation, so do not drive or operate machinery. Discard 30 days after removing from foil pouch. So the allergy medications, chlorpheniramine, diphenhydramine, clemistine, cetirizine, desloratadine, loratadine, and levocetirizine all can cause dizziness or drowsiness, and alcohol may increase the effect. Technically, cetirizine and loratadine shouldn't produce drowsiness, but it is reported in some patients. For the inhalers, the nasal sprays, you're going to leave them in the foil pouch until you're ready to use them. Protect oral disintegrating tablets from moisture. For the glucocorticoids nasal sprays, we should shake well and rinse and dry tip after each use. Same with the cromolyn sodium nasal spray. And then if we use Opticron cromolyn sodium eye drops, we want to make sure we remove the soft contact lenses before. Montelukast, the chewable tablet, should be taken with a large glass of water. And if you are giving the granules, those should be discarded within 15 minutes. Allergy shots represent a form of immunotherapy. They may be administered to persons with perennial symptoms all year round or seasonal allergies. The rationale for immunotherapy is to reduce the level of IgE, immunoglobulin E, antibodies in the blood, while at the same time stimulating the production of IgG, a protective antibody. Allergy shots are administered by subcutaneous injection as a series of shots. Each injection has an increased concentration of the allergen that produces sensitivity. Allergy shots can reduce allergy symptoms over a longer period of time than all other treatments.